Hello everyone, this is Dr. David Rosen, and in this video I'm going to help you understand the costs of vein treatments. We'll talk about insurance plans and a bit about the process of obtaining coverage. I'm going to try to keep this as fun and informative as I can, and I'll also answer some frequently asked questions along the way, but feel free to jot down your own questions and bring them with you to your initial consultation. I hope you'll enjoy watching this, so let's begin. Many patients who seek my help have suffered from annoying, often symptomatic chronic varicose and spider veins for many years. Though it's a problem often overlooked or perhaps only glossed over by other physicians, you should know that chronic superficial vein disease is extremely common. You are definitely not alone. About half the population has some sort of vein issue during their lifetime, and about 25 million Americans suffer from chronic vein disease right now. Vein disease isn't just about varicose or spider veins, though. It's actually a spectrum of issues, ranging from absolutely nothing apparent at the surface, but at the same time having significant aggravating symptoms, including aching, heaviness, fatigue, leg cramps, swelling, restless legs, and other symptoms as well. The spectrum then continues with just small, spidery veins scattered across the lower extremities, to bulging varicose veins, to chronic leg swelling, and as the process continues over the course of time, chronic leg discoloration and even loss of skin integrity or ulcer formation may occur. Interestingly, much of the later effects are preventable if dealt with early. Being a proactive rather than a reactive patient is a wise approach regarding many diseases, certainly including chronic superficial venous disease. So why don't patients choose to deal with this sooner? Well, the most common reasons include concerns about the safety of treatments, about potential discomfort that they envision regarding treatments. Patients also worry about downtime, about missing out on work, exercise, and hobbies, and they also wonder if going through all of it is actually worth it. Are treatments actually helpful? Well, the first thing I often tell patients is that they may have waited years, but at least they waited for the best time to get their veins evaluated and treated, because over the past decade or so, surgical treatment of superficial vein disease has generally gone by the wayside. And newer, state-of-the-art, non-surgical procedures that I provide are very safe. They have minimal discomfort during and after the procedures. They require either little or no local anesthetic, and certainly no sedation is required. In addition, there is no downtime. Patients can resume most routine activities immediately after their treatments. You can drive yourself to and from your visits. Techniques such as endovenous laser ablation or Clarivein, one of the latest advances in vein care that only a few practices like mine offer, along with sclerotherapy injections, all of those have been demonstrated in numerous studies to be highly effective. The procedures work, but it's important to realize that healing takes time. Nowadays, with the cost of everything rising, many patients put off getting their veins evaluated because of concerns about the costs of care. Many people think that vein care isn't affordable because they think, incorrectly, that it couldn't be covered by insurance, so they put this issue on the back burner and they ignore it for years until it finally reaches a tipping point. So, many of my patients are thrilled to find out that many procedures that lead to legs which feel and look better than they have in years may be covered by most insurance carriers and even Medicare. Well, I'm here to tell you that your symptoms, your varicose and spider veins, aren't, quote, cosmetic. Little elves didn't come paint them on your legs while you were sleeping. They are medical issues. It's just that the insurance companies often label them as cosmetic if your issues don't meet their specific coverage criteria. Judging by the overwhelming response I've received in the past regarding free guides I've written about the costs of care, financial costs weigh on many people's minds. When I started my practice, I made an effort to design a place where I would feel comfortable sending my family to, sending myself to. I don't know about you, but I really dislike surprises. To me, the most important word that encapsulates my scientific, moral, and ethical approach to patient care is transparency. I created a practice where patients can feel comfortable discussing their concerns, all of them, especially financial ones, in an open way. Such open discussions have to happen in order for you to be able to make decisions that make sense and feel comfortable. Because when it comes down to it, you are the president of your body. Doctors like me are here to be your trusted advisors. It can be difficult to navigate the medical world, and you need someone to be your secretary of explaining things. You need info that is unbiased, evidence-based, up-to-date, and is presented to you in a logical way. It's what I would expect to get from my colleagues, and it's what you should expect from your doctors too. I can't stress enough how important teaching is to the process of treating every disease, certainly chronic vein disease. That's why I spend an hour with each new patient. I spend a great deal of time getting to know all about you and creating a treatment plan tailored to your needs. But you, Madam or Mr. President, have to make an informed decision regarding consenting for treatments. I take the informing part very seriously. Fortunately, we lucked out. The problems that lead to chronic vein disease are pretty easy to understand. Once I explain how it is I can make a diagnosis using a painless ultrasound study, you realize how relatively easy diagnoses can be made. And finally, you'll come to discover that the state-of-the-art treatments I offer are really logical solutions to your problems. But you aren't only the president of your body, you're the secretary of the treasury too. So the remainder of this video will address some of the important info you need to know about the potential costs of your care. Since my primary role is to be your advisor, I do my best to simplify some pretty complex topics. The info isn't exhaustive, but I think it's at least transportable. While I hope everyone out there watching this will consider coming down to Rosen Vein Care to see me, I don't think it's reasonable to expect people from across the nation or across the world to actually do so. So, I hope this helps you navigate some of the trickier roads on the way to happier legs. If you can't see me, I hope you can find a place that has the same philosophy about transparency as I do. So it all starts with a consultation. And let's talk about vein care costs. Whenever my assistant, the wonderful Maria, is busy, I jump in and answer the phones. It's not uncommon for potential patients to ask me on the phone about the cost of their care. Well, I'd love to tell them a complete answer. There's just no way of assessing people with a phone call. In order to figure out what your specific vein issues are, how to approach treating them, and whether or not they may be covered by insurance, the process starts with an initial consultation. A consultation means many things to lay people, but to doctors it is a thorough, systematic look at who you are and how to approach and treat your problems. If you have insurance and your doctor performs a medical history, a physical exam, and other testing, these things are generally covered by the insurance carrier and Medicare. Some of you out there might be thinking, wait a minute, Dr. Rosen, before we get all wrapped up in discussing insurance-related things, what if I don't have health insurance? Well, good question. With every aspect of your medical and financial involvement with my practice, my primary goal is to alleviate your discomfort and worries. Look, my parents, both Holocaust survivors, came to the U.S. after World War II with little surviving family and nothing but change in their pockets. The world can be harsh enough as it is, and I believe that in order to truly fix what's broken about the planet, we have to approach our interactions with each other with a sense of community spirit. When each of us heals, we all heal in a way. With that in mind, I never turn anyone away based on financial means. I do my best to make the care that I provide comfortable and state-of-the-art, but also affordable. If need be, we can set up a payment plan. No worries. For those out there with commercial insurance or Medicare, let's continue on and talk about how insurance works. Well, we were talking about consultations and insurance coverage. On the doctor side of the equation, doctors see patients and perform procedures. Taking histories and doing physical exams are also considered procedures for the sake of billing. If a doctor is contracted to see patients who have a policy with a particular insurance company, the docs are contracted to bill such procedures. The doctor submits a particular code or a set of codes related to the visit to the insurance company, sometimes accompanied by clinical data obtained during the visit. The insurance company agrees to pay the doc a negotiated rate for their services. When insurance companies are involved, patients are expected to have certain payments. Typically, patients pay month-to-month premiums in order to continue to have coverage with a particular insurance plan. In addition, patients' policies typically have some form of deductible, an amount of money that the patient is responsible to pay each year out of pocket before the insurance company kicks in extra money towards care. This can range from a $0 deductible to thousands of dollars. This means that if you have, let's say, a $1,000 deductible, you can expect to pay the first $1,000 of your care out of pocket before the insurance company kicks in more of their money. It's really important to know that deductible years typically end on December 31st, and a new year, with a new full deductible to meet, starts on January 1st. That's why many patients try to get as much done as they can once they have met their deductible. It's also why most doctors' offices are busiest during December. Fun fact for you. Once you meet your deductible amount, most plans then have a coinsurance percentage that patients are expected to pay towards the cost of care. For instance, if your procedure costs $100 and if you have met your deductible and you have a coinsurance rate of 20%, then you will owe $20 and your insurance carrier covers the remaining $80. Make sense? Hope so. But with most, but not all policies, you can also expect to pay a copay for most doctor visits. The copay is the amount you have to pay directly to the doctor. The amount varies by primary doctors versus specialists, and copays also vary by policy. You may find the copay amount on the front of your insurance card. If it isn't listed, you can also call the customer service number on the back of your card to learn about your remaining deductible, your coinsurance amount, as well as your copay. Okay, so let's bring this back to vein care. You come to see a vein specialist, and if you're there for a full consultation, history, exam, ultrasound, the works, if you will, you can expect that your visit will be billed to insurance, and you may need to pay a copay. Eventually, you will likely receive by mail or email a statement from your insurance company called an explanation of benefits, or an EOB. This EOB will show you how much was billed. Don't freak out about those numbers, because the only one that matters is the patient responsibility and what that amount might be. Patient responsibility amounts can depend on how much deductible you have left to meet or your coinsurance amount if you've already met it. Another question I sometimes get on the phone is, hey, what about all those other places that I see that have ads that offer, quote, free consultations? Those offers seem to cause a lot of confusion. Patients go to those visits and many times learn that the visits will be billed to insurance, especially if an ultrasound is performed and if potentially coverable future care is discovered. Translation, they might not actually be free. Nor can they be, because the docs were contracted with the insurance company to do the work and bill for it. This leads to yet another question that I sometimes get asked about. What about the other places that ran a Groupon or something like that? I don't do them. Again, they're confusing. This kind of goes against my transparency philosophy. Many treatments may be coverable by insurance, so why would anyone pay cash up front before knowing whether care is coverable? I wouldn't. For those of you out there who are considering doing it against my suggestion, I'd at least read the fine print carefully. I'd also ask who would be performing the assessment and treatments: a board-certified doctor like me, a physician assistant, a nurse. There are other medical legal reasons why I wouldn't do such offers, but we'll save that discussion for another day, perhaps. Well, we talked about what I wouldn't do, but what would I do? If you're truly only interested in basic information, I'm willing to provide basic answers. You've figured out by this point that I'm passionate about teaching and having well-informed patients. I'm committed enough to offer you 15 minutes of my time as a free informational session or a triage session. But if you are ready to move forward and get specific information regarding your diagnosis and get a treatment plan tailored to your specific needs, at that point, the triage session will transform into a consultation, and your insurance carrier will be billed for that visit. During your consultation, if your issues appear coverable under the typical policies of your carrier, my assistant Maria Santana and I do all the legwork, pun intended, for you to obtain the coverage we believe you deserve. Typically, insurance companies will cover one endovenous closure procedure per saphenous vein, and you can see other lectures in this series or visit my website for further explanation about those procedures. In addition, they will typically subsequently cover 3 sessions of sclerotherapy per lower extremity to clear up remaining surface veins. However, there are typically some hoops that patients have to jump through before the insurance companies will grant coverage for procedures. Some of those hoops might include typically a trial period of conservative management with compression stockings that patients have to do. The requirement is universally goofy, but to paraphrase Tolstoy, each insurance company is goofy in its own way. Blue Cross typically requires 6 weeks. Humana, Aetna, United Health, and Cigna require 3 months. 2, veins being considered for treatment need to be of a certain size. And 3, veins needing treatment by endovenous closure also need to have a certain duration of reflux. And again, I explain a lot of these more technical sort of shop talk on my website and in other lectures that I do. If patients are found to have incompetent veins needing closure during their consultations, I typically fit them with compression stockings and then make plans to recheck them at the end of the trial period mandated by their particular carrier. After the follow-up visit, so either at 6 weeks or 3 months depending on the carrier, it usually takes a few more weeks still before the approval is processed. Once we get the approval, though, we get you on schedule and get things going in the most efficient way possible, both time and cost-wise. Once we know the number of endovenous procedures you may need, along with your remaining deductible and your coinsurance ratio, we can help you guesstimate your out-of-pocket costs. One variable that may be hard to guesstimate before starting treatments is the overall amount of sclerotherapy sessions that may be required to clean up the surface veins. Still, we do the best we can to eliminate as much of the surprises as we can. Well, I hope this has been informative for you. There certainly is plenty of great information left for you to discover about vein disease and vein treatment. Again, I encourage you to visit my website, rosenveincare.com. I spent a great deal of time and, frankly, money to make it chock full of helpful, easy-to-find information. But don't stop there. Better still, come visit me in person. And if you call now, we can typically get patients scheduled within 3 business days. Here's some important parting notes for you. Maria and I do everything we can to get you the coverage you may deserve, but obtaining coverage takes time. 2, it took years for those annoying veins to develop. It won't take anywhere near as long to treat and get things to improve. But again, healing takes time. 3, winter's coming, and 4, the deductible year is likely for you to be ending soon, and both of those factors mean that my schedule will get busier over the coming months. If you are finally ready to take the first step down the road to legs that feel and look better than they have in years, let me suggest that now, like right now, is a great time to take that step and step on into my office for your initial consultation. Thanks again for spending these minutes with me. Other than appreciating the need to be conscientious about costs and the need to help fix what's broken about our world, my parents instilled in me the appreciation for the privilege of being a physician, for being able to help others, and the responsibility to do so in a conscientious and caring way. I look forward to meeting you and not only meeting, but exceeding your expectations. See you soon. Thanks.